When I was a medical student was the first time I ever really did anything international. I didn't travel a lot growing up, and I went as a fourth-year student to Jamaica, the island of Jamaica, and worked in rural public health there. And it was really an eye-opening experience to be able to see how so many billions, actually, people have lived around the world. And I really learned so much from that opportunity and got the chance to help a little bit for the month that I was gone. And then after that, I did a month on an Indian reservation in Wyoming through the Indian Health Service. And so being able to see the different cultures, being able to see the different ways that health is affected by poverty, both internationally and in the States, really was really motivating for me and inspiring for me to try to practice in those areas. I2CRP, it stands for the International Intercity Rural Preceptorship Program. The program was created probably close to 15 years ago, and it was started out with just one eye as the Intercity Rural Preceptorship. And when I came on board here about 6 years ago, we wanted to kind of capitalize on the learning opportunities and the needs in the international underserved settings, but also the student interest in global health. We've been able to almost double the size of the program now. Always amazing to see folks who might have passed away if we weren't there with the antibiotics, or if we weren't there to take them to the hospital, and you come back 6 months later and they're walking around and doing great and greeting you. One of the projects that we've helped with has been an improved cook stove project, and that's been one of the most amazing things is to go into a kitchen where women and children will spend hours upon hours upon hours inhaling all of this smoke and particulate matter, and then 4 or 5 hours later, community builds a better stove and you can stand up, you can breathe, and it's just really amazing to be able to help in a way that does provide immediate impact, but also really does affect a lot of different factors for people's lives. If there's even one patient that I've had contact with that feels better about themselves and feels better physically because I've been able to be a part of that. If there's one student that really says, this is about service. If you're gonna be a doctor, you gotta help people, you gotta serve. That would make me happy.